Hi, my wonderful students. Welcome to today's lesson. What a wonderful day to be here. My name is Wahome Emily, and we are here for Nutrition Epidemiology, BND4102. And I'm from the School of Public Health, Department of Nutrition and Dietetics. And today, we are going to handle a topic by the name Epidemics. Currently, we are all aware that we are experiencing an epidemic, and I'm sure all of you in class are aware of what epidemic we are experiencing, the coronavirus epidemic. So it's such a coincidence that this week we are handling this topic, and therefore we have a current example to deal with. So we shall go directly into the content of the lecture. And before we go further, we want to see which areas that we'll be looking at in this lecture. So first of all, we shall have some definitions for us to understand exactly what an epidemic is. And then we shall have types of epidemics to just explore and find out what are these types of the different epidemics that we have. We shall also look at the causes of epidemics that we have, and how we investigate outbreaks, or why we investigate outbreaks, or the importance of investigating outbreaks or epidemics, and also measures of controlling these epidemics, because it's important for us to know how do we control these epidemics from occurring. So by the end of this lecture, as my learners, I would expect you to be able to define those terms that you're going to have, be able to mention to me some types of epidemics, causes of epidemics, and how we investigate outbreaks, and also the measures of how we control epidemics. So I expect you to be keen so that by the end of the lecture, we are able to do that. So we go directly to epidemics. And epidemic, the other word is outbreak. We use these words interchangeably. Sometimes you'll hear someone talking about epidemic, sometimes they talk about an outbreak. It's more or less the same thing. So an epidemic basically is occurrence of cases or disease in excess of what is normally expected. So any kind of disease that we have so many people being infected with that particular disease within a short period of time, and the numbers are very large, that is basically the definition of epidemics. It can be in a community, a particular community, or in a different region. So an epidemic is usually widespread, quite widespread. So it will affect many people within a geographical region. It will affect many people within different countries. And when it spreads to different countries, then now it graduates from an epidemic to what we call pandemic, because it's affecting many people within a short duration of time in different and many countries. So the example I gave you at the beginning of the lecture, coronavirus, for example, is an epidemic, and it's also a pandemic, because it's affecting different countries and actually almost the whole world. So it's a very good example for us to look at. So there's also an aspect of time, so at a particular time. So you may find, like now in history, we'll be saying coronavirus affected Kenya in 2020, maybe between March and April, August, or up to when maybe we'll stop experiencing new cases of the virus. So this is a very important topic today as we continue. So having known the definition, or having known what epidemics are, or outbreaks, then let's look at some of the causes, what may cause an epidemic. So some of the causes that we are going to have is recent increase in the amount of virulence. That is proportion of persons with clinical disease who become severely ill or die of the agent. So increase in virulence. So like maybe the virus was existing before, but it was in minimal amount from whichever country it was in, and therefore it was not affecting people. But then when the virulence of that particular agent, disease-causing agent, increases, then it becomes an epidemic. So the coronavirus is an example, like we've said. Cholera is usually a very good example also that we have experienced in Kenya before. Countries like Uganda have experienced disease like Ebola. It's also an example of an epidemic. And that increase in virulence means that more people are getting infected every day, every hour, every minute, and so many people suffer from that particular illness. The other one is recent introduction of an agent into a setting where it has not been before. So like we've never experienced coronavirus in Kenya. So it's a new virus that we are experiencing. And therefore, as a nation, we have not developed immunity against such a virus. And therefore, it means that when it occurs, then we are likely to suffer from it more because our bodies have not developed immunity against this virus. So a virus or a bacteria or whatever disease-causing agent, if it's new in a particular community or a region, then it means that it may cause an epidemic. Another example is an enhanced mode of transmission, so that more susceptible persons are exposed. An enhanced mode of transmission. So like now we are aware that coronavirus is mostly being passed from one person to another through like shaking hands or touching surfaces where the virus is. So if there's an enhanced mode of transmission, like us Africans, we love shaking hands. So that is an enhanced mode of transmission, because if I shake a hand of someone who has the virus, has coughed on their hand and the virus is there, and I shake their hand, and I don't wash my hands properly, or I don't wash my hands before I eat, then it means that I can easily get contaminated or infected with the coronavirus. Then the other one is some change in the susceptibility of the host response to the agent. So susceptibility is how likely or what is the probability of you getting the infection. And I'm sure we have also heard that the elderly people may be more susceptible to the coronavirus just because of their age, or people with other disease conditions like diabetes or HIV and AIDS. That is a factor that makes someone more susceptible. Or like because we are learning nutrition, if I'm not of good nutritional status, like I'm not having a healthy diet, and therefore my immunity is a bit compromised because of that, that would mean that then if I get contaminated or I get infected, then I'm likely to get sick from that particular disease-causing agent. Then the other cause may be factors that increase host exposure or involve introduction through new portals of entry. So there are many ways in which this agent may be passed from person to person. So if there are other ways that come on board, then that means then that can be a cause of that particular virus or epidemic. So those are the causes of epidemics, and there are many more. And then after looking at the causes of epidemic, then we can look at the types. What are the types of epidemics that we have? One of them is what we call common source epidemic. Now, common source epidemic basically occurs when a group of persons is exposed to a common vehicle. For a good example is contaminated food. So for example, let's say I go with a group of my friends in a restaurant, or as Kenyans, we like having nyama choma. So we go for nyama choma, and then that particular nyama choma we are having probably was handled by someone who was infected with a particular illness, like cholera or even the coronavirus. And then we consume that food. Then after consuming that food, after a few hours or a day, we start complaining of different signs and symptoms. We shall call that a common source epidemic or a common source outbreak, because this food was the source of that particular epidemic, or that particular epidemic came from one particular source, which was the contaminated food. It could be contaminated food, contaminated water, whatever you may have taken as a group, and it caused that particular epidemic. So that is what common source epidemic is. And a good example of common source epidemic also could be an epidemic like cholera, because we know cholera is a type of epidemic that's actually orophycal, such that if I'm contaminated with Vibrio cholerae, which is a bacteria that causes cholera, and I go prepare food, and I'm not very hygienic, I'm not observing personal hygiene, then it means that I pass that bacteria into the food, and someone else consuming that food then gets that particular bacteria, and they get infected. Then the other one is point source epidemic. Now, point source epidemic is actually a type of a common source epidemic, but this is where susceptible individuals are exposed to one source of infection, and this results in a very rapid increase in the number of cases and often in a few hours. So what happens in a point source epidemic, you may have the infection being a common source, but this one happens quite rapidly within a few hours, and it progresses very fast, affects a large group of people. And also cholera can also be an example of that. Then we have what we call propagated or progressive epidemics. And a progressive epidemic basically is an outbreak that does not have a common source, but rather spreads gradually from one susceptible host to another. So a progressive epidemic is a person-to-person contact. So for it to happen, you need to have person-to-person contact. And this epidemic, just from the name, it progresses slowly and rapidly. So if you are looking at the propagated progressive epidemic curve, it rises rapidly and slowly because it progresses as the infections are taking place. So it is either, it can happen directly or indirectly, and it grows as it spreads. So as it moves from one person to another, it continues to grow, and the curve continues to rise. And usually the transmission is, we have said, is from direct person to person. A good example is syphilis, is a sexually transmitted illness, is from person to person contact through sexual intercourse. So that's a good example. Then we have what we call mixed epidemics. And mixed epidemics, they show characteristics of both the common source and the propagated epidemics. So the epidemic will be from a common source, but at the same time, it will have characteristics of it being having person-to-person contact, or being passed from person to person, and then it will grow intermittently. As new infections come, it continues to grow, and until a particular point when maybe now the epidemic will be dealt with, and then the numbers or the incidence of the epidemic starts going down. So most of the time, mixed epidemics are often caused by foodborne infectious agents, or what we call foodborne illnesses. Good examples of foodborne illnesses, we have like hepatitis A is a good example, whereby someone who is infected with hepatitis A handles maybe food not very hygienically and passes that to another person, and it keeps passing from one person to another. We have Salmonella typhi being also a foodborne illness, or even water, contaminated water, foodborne illness also. Salmonella typhi is a good one. We also have a bacteria that we call E. coli, which is also a very good example of mixed epidemic, which of foodborne illness, which may occur. So that's another example of mixed epidemics. So those are the four major types of epidemics that we may have. So then we go to, after understanding what an epidemic is and seeing the causes, and now we have seen different types of epidemics, we need to ask ourselves, is it really important to investigate in epidemics? Why should we investigate epidemics? And we have understood that epidemics actually affect large groups of people, so many people are sick at the same time, and also that means it impacts on the resources of a country. Like if you look at a country currently like China that have been battling with coronavirus, Italy, and also currently the US, they have used quite a number of resources to try and fight the infection, and also to try to deal with the infection so that then we don't have new infections. And even us in Kenya, the Ministry of Health and the government is doing exactly that, using a lot of resources to try and contain the infection. So definitely investigation of an outbreak is very, very important. So the first reason why we investigate outbreak is to halt the outbreak and prevent further illness. So currently, we are all asking ourselves, how do we stop this outbreak? How do we stop the coronavirus outbreak? Everybody is asking themselves that. So scientists are at work, everybody is at work. We are all being asked to take caution, to take measures, to self-quarantine, you know, to wash our hands every time, to sanitize, and all that. It's because we need to halt the outbreak and prevent further illness. We need even to prevent the new infections from taking place. So that is very, very important. Then to address public health concerns, disease outbreaks often attract publicity. Currently, everybody all over the world, when you go to the news, it's about coronavirus. So it's a public health concern. People are worried. about this coronavirus, many people are not able to go to work. So it's a public health concern. And for us to handle the public health concerns, then the relevant departments, especially from Ministry of Health, have to look at how to investigate that outbreak and come up with ways of controlling the outbreak from spreading. So that's also very, very important. Then we have, the other one is to involve the public in disease control. So the public have to be involved for us to control these epidemics from happening. That's the reason why there's a lot of education on how to handle the virus, for example. So to handle the public in terms of involving them in the disease control. Then the other one is to reduce direct and indirect costs. We have just said that epidemics come with a lot of costs because there are many people getting sick at the same time. So you want to see how, at the end of it all, we want to control how much money is being put in the expenditure, because even after the epidemic, then there are other things to be dealt with. So we want to promptly and timely deal with the epidemic so that then it's not taking for a long time, too long to come to an end, and then it is using all our resources. Then to identify new mechanisms of transmission of known illnesses. So apart from, for example, person-to-person contact, are there other modes of transmission of that particular virus or bacteria? So through investigation, we're able to learn that there could be other modes of transmission, and therefore, once we learn that, then we are able to control the spread. Then we also have to identify new mechanisms of transmission of known illness, and also to identify new or emerging disease agents. So we know the coronavirus is being caused by that particular virus. Could there be another cause that we don't know about? So during the investigation, then, we are able to understand that. Then to satisfy legal and international obligations. So it's an international and legal obligation for every country to investigate an outbreak when it happens and come to an end of it. Then to help train public health staff. Through investigation, the public health staff are trained on how outbreaks are investigated. So those are reasons why we investigate epidemics. And currently, a lot of investigations are going on to try and investigate the coronavirus epidemic, and we come with a conclusion of how we are controlling the epidemic and how we prevent this epidemic from occurring in future, because epidemics recur. So then, after understanding why we investigate outbreaks, then it's very important to learn what are some of the steps that we use in investigating these outbreaks. So when you go to an investigation, the first thing you must prepare for, field work. So if I'm a health worker and I'm being involved in investigating an outbreak, there are some preliminary things that I'll have to do before actually I go to the field to interview people or to do other field work. So I will make sure in preparation of field work, I have all the resources that I will require. I have all the personnel. I have all the resources that I'll need to actually go and investigate that particular outbreak. Then the other thing, I have to establish the existence of an outbreak. So I have to confirm that actually that outbreak is existing. So I must have some data. How many people are infected? How many people have died from that particular outbreak? How many regions, for example, in this country, Kenya, or even in the world, are suffering from that particular outbreak? So I must have that data or information with me. And then I verify the diagnosis. What is this particular outbreak that I'm dealing with? What are the characteristics? What are the signs and symptoms before I go to the field? Then you construct a working case definition. A working case definition is simply someone with cholera. What are the characteristics? What are the signs and symptoms of cholera, for example? That is a case definition of cholera. So the person explains very clearly that someone with cholera is supposed to have or will show these signs and symptoms, and therefore it's very clear. Then you find cases systematically and record information. So when you go to the field to investigate, you're going to find cases systematically. You are going to have cases, you interview them, you get the information. Where did they get the infection from? Because most of the time they'll tell you I had traveled, or I met with this person, we had a party, and my brother was sick. They'll give you information. Or I ate this food in a particular hotel. They'll give you all that information. So you identify cases and record information. So every information you're getting from your respondents, you record it very clearly, because that information, you're going to use it finally when you'll be reporting. Then perform descriptive epidemiology. So descriptive epidemiology is just describing your cases. So every case that you're going to have, you're going to describe it. So for example, you pick one person and say, this person was a male, 50 years old, they come from this region, and they were infected with this virus at this particular time, and these were the signs of the symptoms they suffered. They went to hospital, they took 2 weeks to cure. That is what descriptive epidemiology really is. So it's just describing the characteristics of every case that you are going to interview. Then you develop hypothesis. So previously we have said what hypothesis is. In an investigation, you also have to develop hypothesis. So for example, you can say, if you are dealing with cholera outbreak, you can say that the cause of cholera outbreak, for example, in Kibera, was consumption of contaminated water. That is a hypothesis. Then as you investigate, as you interview people, you are going to establish whether it is true or not, and then you reject or accept the hypothesis at the end of the investigation. So that's actually what hypothesis or developing hypothesis really is. So we continue with steps of investigating epidemics. The previous one we have said we develop hypothesis, and we have explained and I've given an example of a hypothesis. Then the next step is evaluate hypothesis epidemiologically. So as you go on, as you investigate the outbreak, you're going to be evaluating your hypothesis to see whether it is answering the questions that you are asking yourself as you start the investigation or not. So you'll keep evaluating the hypothesis epidemiologically as you go on. So evaluation is a continuous process as you continue with the investigation. So as necessary, consider to refine and to reevaluate that hypothesis. So as you go on, you may require to reevaluate that hypothesis depending on the findings that you're finding in the field as you interview your respondent on that particular epidemic that you're dealing with. Then you compare and reconcile with the laboratory or environmental studies. So you're in the field, you're interviewing people, but elsewhere there could be some other information that is being gathered. And in an epidemic, there are laboratory experiments that are going on. So someone else is conducting laboratory experiments or trying to find out what is really the cause of this epidemic. So whatever information you're finding in the field from your respondents and what is being found in the lab, you compare and reconcile. Try and see, is there similarity? Are there differences? Is the information agreeing or not? So that is also very important. And then implement control and prevention measures. So what are some of the control measures and prevention measures that actually can be employed or can be used in future to control this epidemic from happening? So you come up with them in your report. And then the next step, you initiate or maintain surveillance. So surveillance is a continuous process of trying to deal with epidemics. So if you, for example, you experience that cholera in a particular place is being caused by contaminated water, you put measures, the prevention measures. So for example, you provide safe water to that particular community. Then periodically or continuously, you do what we call surveillance. So you are monitoring and evaluating at the same time to establish whether you're having any new cases of cholera, and if they're happening, why are they happening? And yet, you have intervened by giving people safe water to drink. Then the last step of investigating an outbreak is communicating the findings. So at the end of it all, of investigating an outbreak, the findings have to be communicated to the public, and there are different ways in which it is communicated. You can communicate through media. Of course, it goes through the Ministry of Health and the government. The information is passed to the community. So through media, whether print media or broadcasting, whatever modes of communication that will reach to almost everybody or everybody in the country will be very, very important so that people can understand what was the cause of the cholera outbreak, what are some of the prevention measures, how do we prevent cholera outbreak or coronavirus outbreak from happening again in this country. And that is very, very important. So as we've seen, investigating outbreaks actually is very paramount and very important for us to do that. Then we look at measures of controlling outbreaks or epidemics. How do we control epidemics from spreading? Because once we have them, then the next thing to do is to control these epidemics from spreading. So the first thing is measures that are directed against the reservoir. So this is where the epidemic is coming from. Reservoir could be the host or a person. So like in the case of coronavirus, that could be, can be what we are calling the quarantine. So if I have the infection, it means that I stay in a particular place where I'm not interacting with other people, because it means if I interact with people, then I pass the virus to them. That is what we are calling the quarantine, and which the government is telling most of us to do. So even if I'm not infected, also I can do quarantine, so that then I don't expose myself to those people who are sick and then I contract the illness. And that's a very important way of controlling epidemics. And mostly quarantines are done within the possible incubation period, because even within the incubation period, the person can still pass the infection to you. Then measures that interrupt disease transmission, and this includes things like purification of water, treatment of water, pasteurization of milk. In this case, a good example of coronavirus is basically personal hygiene. Personal hygiene will interrupt the disease transmission, because we have known that most of the time the coronavirus is being passed through our hands or touching surfaces that are contaminated with the coronavirus. Then we have measures that reduce host susceptibility. So it can be something like immunization. Like if we have a vaccine against coronavirus right now, and we are all immunized against the virus, then we can reduce the numbers of people who are being infected with the virus. So those are some of the ways. Or like having good nutritional status. So adjusting our diet to a healthy diet, then it makes us more strong to the infection. Then the other one is surveillance, and this is just keeping tabs on the disease to understand its epidemiology and thus come up with appropriate interventions and measures, e.g. analysis of annual Ministry of Health reports. We want to analyze what diseases have taken place within a period of time, what are their causes, and how do we prevent these diseases from happening. Like you've said, surveillance is an ongoing process. It's not something you do once off. It's something that you have to keep doing and checking. Why are we having these epidemics? How do we prevent these epidemics from happening going forward? Then the other one is disease eradication, and it has been done successfully in the world. Like we have an example of smallpox that was eradicated after WHO initiated that strategy in the 1960s. So that is another way we can completely eradicate some of these diseases that are affecting nations, that are affecting the whole world, by putting different measures. So that is very, very important. And that's also another way of controlling epidemics. So it's very, very important for us to understand that, and also to know that most of the epidemics, like we've seen from the examples, they're actually caused by things sometimes we have control over. So it's very important for us to understand that we can actually control epidemics, and when they occur, we can minimize the number of cases, or we can minimize the number of people who actually will be infected by that disease by simply following the precautions that we are being given. So I hope we are all following the precautions that we've been given seriously, especially the self-quarantine, even if you're not sick. Or if you're sick, then you quarantine yourself so that you're not passing the disease to other people. And also practicing the personal hygiene, hand washing, proper hand washing, like we've been shown using water, running water, soap, yeah, and also keeping the social distance that we are having. So we are coming to our end of lecture today. It was a wonderful lecture, and I wish you all well, and let us all keep safe and protect ourselves from the coronavirus. Thank you so much. Until next time.
These televised lectures supplement our robust online learning going on our MKU online platform. You can view more on our televised lectures via our online platform. We are in a digital era, and Mount Kenya University knows this. The following are the steps to follow so as to complete your online application. Download the application form from the website www.mku.ac.ke. Attach copies of your academic certificates and ID. Pay the application fees via M-Pesa pay bill number 270988. Your ID is the account number. 2,000 shillings is the charge for a postgraduate. You can also deposit in the bank accounts provided on the website. Then email all the above to apply@mku.ac.ke.